of Phatak Materia Medica live series. Today's remedy is AGRAPHIS nutans. So we will decode the AGRAPHIS nutans today. It is a small remedy but useful in day-to-day practice. According to Dr. Phatak, AGRAPHIS nutans is a extremely practical or small remedy, especially more usually in ENT disorders and childhood cases. The remedy acts on the mucous membranes, lymphoid tissue, adenoids and tonsils, general tone of the system. So three main action of this remedy: mucous membranes, lymphoid tissue, adenoids and tonsils, and general tone of the system. So Phatak describes the AGRAPHIS beautifully, that AGRAPHIS relaxes the whole system. AGRAPHIS relaxes the whole system, and from this relaxation all problems follow. So core of this remedy is relaxation, obstruction and susceptibility to cold. So in AGRAPHIS child or patient has poor tone, lax tissue, blocked passages and fall sick easily from cold winds. So it is not an inflammatory remedy, but it go to the nearby constitutional remedy in the pediatric cases. AGRAPHIS nutans does not fight inflammation, it corrects the relaxation. So in AGRAPHIS, typical patient looks soft, flabby, relaxed, often pale, prone to catarrh or cold, frequently ill after exposure to cold air. Patient may say that, doctor, every time cold wind flow, he catches the cold. This is a strong confirmatory clue to the this remedy, like Calcarea carp, tuberculinum. So mental picture of the AGRAPHIS nutans is quite key mental picture is mutism of child unconnected with deafness. The important important point is the mutism of childhood. It is not like autism. It is a patient anxiety or fear of speaking in people or in public. So this child speak when at home, but when he goes outside he can't speak. The child can't speak, but he does not speak. This child can speak, but he does not speak, or he speak very little. So patient's mother may say that he understand everything, but he doesn't talk much. So mutism is not autism, it is not intellectual disability, it is linked with due to the maybe chronic ENT blockages, or he may be have a suffering of tonsils or adenoid due to the he is speaks very little or afraid of speaking. Always examine the tonsils and adenoids of these silent children. Physical general symptoms are prone to take cold, worse from cold wind, relaxed constitution, poor resistance, thermally chilly, sensitive to cold air, energy, low tone, tired easily. Particular symptom, the core action of this remedy is ENT. So adenoids, enlarged tonsils, throat deafness, hearing reduced due to the eustachian tube blockages, improves when throat condition improves. This is also one of the characteristic symptoms, that due to the throat concomitant symptom, due to the throat adenoids or tonsil condition, hearing abilities decrease. This is a functional deafness, not a nerve deafness. In nose and throat, chronic nasal obstruction, mouth breathing, thick mucus, recurrent cold. Suppressed cold due to the improper treatment of coryza. In gastrointestinal system, the agaricus has mucus diarrhea following the suppressed cold. Disease has shifted from mucous membrane of the nose to the intestine. Suppressed discharges often changes the disease location. So in day-to-day modern diagnostic conditions that may useful for the use of or prescription of the AGRAPHIS nutans is that adenoids hypertrophy, the key action, chronic tonsillitis, otitis media with effusion, eustachian tube dysfunction, mouth breathing children, speech delay secondary to ENT obstruction. So, prescribing totality is for AGRAPHIS is child prone to cold winds, prone to feel ill, enlarged adenoids and tonsils, throat deafness, mouth breathing, mutism without deafness, mucus diarrhea often after suppressed cold. If the tissue is relaxed and blocked, the AGRAPHIS fits. Phatak saw repeatedly that relaxed children's adenoids, tonsils, throat deafness, and speech issues are the key identification patterns of the AGRAPHIS nutans. So, relaxation obstruction is due to the secondary problem. So, and remedy relationship, the next part of the that Phatak described, that complementary remedies is Baratakar. When mental development is also delayed, child is timid, shy, immature, tonsils enlarged but mentally slow. In sequelae, that in acute stage or due to the obstructive stage, AGRAPHIS may clear the obstruction, Barata builds the development. Another remedy which is related is calcarea carb. When constitutional is flabby, flatty, sweaty and chilly, with delayed milestone and poor resistance, we may think of calcarea. AGRAPHIS opens the drainage, calcarea carb strengthens the structure. Another remedy is Kalimur. Kalimur has thick white mucus discharges, acute or subacute tonsillitis. AGRAPHIS Kalimur for exudation and AGRAPHIS for chronic hypertrophy. Another remedy we may want to differentiate is tuberculinum. Tuberculinum also have recurrent cold, adenoids with strong family history, but child is restless, changing symptoms. Tuberculinum addresses the diathesis, AGRAPHIS addresses the local expression. Potency selection, low potency help in many cases, mother tincture and 6 and 30 potency that I frequently use. With mother tincture daily 5 drop at night, patient gets improved, the potency will uprise 6 and 30. So, when not to prescribe agaricus or common mistakes by prescribing the agaricus. There is acute high fever, suppurative tonsillitis, true sensorineural deafness, speech delay due to the neurological autistic children. So, AGRAPHIS is the mechanical functional obstruction, not organic dysfunction. Another common mistakes that prescribing adenoid just because of the adenoids are present, ignoring the general relaxation, not asking for cold wind sensitivity, expecting result in irreversible cases. Always confirm susceptibility to cold wind is the main key of the AGRAPHIS. Another how to think, let us in child who is mouth breathing, snoring at night, enlarged adenoids, catches cold with slight wind, hearing dull due to the throat infection, speak little but understand well, this is AGRAPHIS. So, the core or in 5 to 6 words, how can we describe AGRAPHIS is the essence is that relaxation of the tissue, sphere of action, ENT and lymphoid tissue, keynote, adenoids, tonsils, throat infection, mind, quiet, silent child without mental defect, modalities worse from the cold wind, used in chronic functional obstructive diseases. So, when AGRAPHIS nuts, when relaxation blocks expression correction, not suppression, is the AGRAPHIS. So, this is what about AGRAPHIS nutans. We will thank you for patience listening. We will see you in the next lecture. Thank you.